Hi, this is Dr. Eric Westman with Ask Adapt. This edition of Ask Adapt is what should my fat intake be? A lot of confusion about this. Trying to make it simple for you. It partially depends on what your goal is. That is, how much fat you should have depends on your goal. The reason for that, in my world, where the low carb, high fat diet, LCHF or keto type of program for diabetes and obesity treatment, we don't have people counting macros. We don't have people monitoring their fat intake, getting to a goal or a target of fat intake. That's just not part of the whole training, and you don't have to do that for diabetes and obesity. You let your fullness be the guide of how much to eat. You're given a set of foods to choose from that has natural fat in the food, so you don't have to be adding extra fats. And a lot of the fat that you're consuming, if you will, your body's using, is coming from your own body fat. So if you're doing this keto low carb diet for obesity and weight loss and diabetes treatment, you don't really have to worry about the fat intake. That's most of the people that I see in my clinical practice. Now, if you're doing keto, low carb, high fat for the treatment of epilepsy or some of these new indications, we're looking at research in terms of other brain conditions like Alzheimer's or other things like brain cancers. People come to me wanting to keep their ketone level at a certain level all day long. So the traditional treatment for epilepsy, the keto treatment, makes your each meal have a protein to fat ratio, and it's important to keep that ratio clear every meal. And the purpose of that treatment is not to lose weight or to fix diabetes, it's for the treatment of some sort of brain condition like epilepsy, Alzheimer's, something like that. That's a big source of confusion. The third source of confusion is the attention to food quality and worry about having certain types of butter, having grass-fed and all of that. The food quality comes from the paleo community, where there is a lot of attention given to the type of fats and the type of meats, and that's not so important if you're using this treatment for other purposes, the medical indications, but it's important if you're worried about inflammation reduction and environmental concerns, sustainability. The paleo teaching is generally higher in carbohydrate than keto, but all of these influences came in to sort of create a confusion. And the main question is, why are you doing this? What is your goal? So to the questions, Anne asks, is the amount of fat a goal or a limit? Again, it depends what you're trying to accomplish. But Anne asks, I read about all of these people struggling to meet fat goals. So you don't have to, if you're using this for diabetes or obesity, let your fullness be the guide. If you're going to be using this for some other indication, then you'll want to pay attention to the ratios of protein to fats. And then says, I've been on keto and intermittent fasting since January, so about 10 months, and have lost about 65 pounds. So I think I'm doing well. You say, fantastic. That's right within the 50 to 100 pound weight loss that I see when people are doing this, what we call ad lib keto, low carb, high fat diet, eating to fullness and not worrying about macros. So Anne, I think you're doing just fine. Don't worry about a fat goal or limit. Pete asks, how much fat is too much? Just enough to ward off hunger? Yes. So eat to fullness. When you're hungry, eat. If you're not hungry, don't eat. This is where intermittent fasting, in my mind, is fine, as long as you're eating healthy, real foods within the keto context, starting with protein first, and then if you're not hungry, don't eat. So you don't have to have breakfast in the morning. It's okay to have 1 or 2 meals a day. Time-limited eating, when you're just eating once a day at a certain time, is fine as long as you don't have excessive hunger. Darren asks, I've lost 100 kilos in 3 years, 50% of my body weight. Congratulations. I'm now holding at 102 kilograms and can't seem to go any lower. I'm assuming, okay, 50% of the body. So you have a lot more weight to lose, okay? So you're kind of in the middle of the whole process. How do I know if this is my normal resting weight? Well, it depends what your normal weight or optimal weight was when you were a much younger man. is my body just adjusting to the big loss? Yes. So when I see someone losing 100 to 200 to 300 pounds, there are times when the weight loss will stop. You just keep doing what you're doing. If the inches are changing, the clothes are still getting bigger and bigger, you just keep doing what you're doing. But there are times when I help people think through, are you eating because of hunger? Are you eating because of habit? There's food all over the place. It's called the toxic environment, where if there's social eating, you're eating with the family when you're not hungry. And so we work toward reducing eating when it's not based on your own body's signals. That might help out, Darren. Keep it going. Ron asks, here's a related question. There's a lot of debate over how much protein, and that's related to the fat because people can choose either more proteins or more fats. Is it better to err on the side of fat or protein? Again, I let people eat from a list of foods, and I don't really prescribe the amount of fat or protein. I let people figure that out on their own. April asks, what about the cholesterol levels? Should I lower my fat intake because of cholesterol? We're not worried about the cholesterol level as long as you're not eating carbohydrates, because the triglyceride and HDL get so much better. So the traditional looking at the total and LDL cholesterol is not so important. So I guess Ron and April, I don't really want you to be too concerned about the fat. Let your body be the guide. Eat mainly foods that have natural fats in them, and it'll take care of itself. Sandy asks, what about, I'm doing this for epilepsy, not weight loss. I have 3% carbs, 10% protein, 87% fat. Again, because you're doing it for a specific ketone goal and you want it that all day long, you do want to pay attention to the fat protein ratio at every meal. And I would refer you to the Charlie Foundation or the Ketogenic Diet for Epilepsy group that's based at Johns Hopkins in Baltimore. That's it for What Should My Fat Intake Be? This edition of Ask Adapt. Put your comments and questions below and subscribe so you don't miss out on future editions. I hope that's helpful.